Assalamualaikum and hi, I am Teacher Afiqah. So today I would like to talk about seizure disorders and epilepsy. So before we go further into uh, seizures and epilepsy, I would like to talk about the definition first. So epilepsy can be defined as a chronic neurologic condition of recurrency seizures that occur with or without the presence of other brain abnormalities, while seizure can be defined as a temporary, involuntary change of consciousness, behavior, motor activity, sensation, or automatic functioning. So, there are two types of seizure, which the first one is generalized seizures and the second is partial seizures. The first one, which is generalized seizures, can be divided into 5 types, which is tonic-clonic, absence, atypical absence, myoclonic, and also akinetic seizures. While the partial seizures can be divided into complex partial seizures and simple partial seizures. The first one types of seizures with generalized seizures is involved in the entire cerebral cortex, while the second one, which partial seizures, is involved in or happen in single location and remain limited or spread to become more generalized. And partial seizures is the most common that found in childhood. And an individual can have these two combination with general seizures and partial seizures, which called as mixed seizure disorder. And based on general seizures that we talked before, it can be divided into 5, which the first one is tonic-clonic. So tonic-clonic, when it about to begin, it showed that an individual may have an aura or sensation, and this is the most frequent seizures that happen, and it can occur at any age. And tonic-clonic seizures involves excessive neuronal functioning, and the duration is it lasts 5 minutes, which is then followed by a postical period about 1 to 2 hours. So it happened when someone loss of consciousness during body becomes rigid or we called as tonic, then rhythmic clonic contractions happen. Then the second type is absent seizure, which is it different from tonic-clonic. Absent seizure does not show any aura or no aura when an individual with these types of seizure, and it it also a momentary loss of awareness, and an individual with this type of seizure also showed no or absence of motor activity except for eye blinking or also rolling, and it lasts less than 30 seconds but no postical period. And when this type of seizure happen, an individual may show like a glazed look, stares, and unawareness of surrounding. Then we go for the third types of generalized seizures, which is myoclonic seizures. So myoclonic seizures is contractions by single muscle or small group of muscles, and it can or it may happen once or multiple, but with very fast. And then the fourth is akinetic seizures, which akinetic seizures is a loss of muscle tone, and an individual that have this kind of seizures or an individual that have these akinetic seizures may suddenly fall, especially when they are standing, and it lasts less than 15 seconds. And then the last one, or the last type of generalized seizures, which is a typical absence, is an individual may stare but able to respond a bit like eye blinking, like a small muscle or muscle movement like eye blinking, and it may begin and gradually, and the duration it lasts 5 to 30 seconds, but most often is it happen more than 10 seconds. And then status epilepticus, which is an extended seizures that happen in children, and this type of seizures, or this status epilepticus seizures, happen for 30 minutes or longer, but it is a rare cases and require medical management. And the treatment that we use, or the medication that use, are intravenous convulsant medication. Next is partial seizure, which as I said before, partial seizures is the most common seizures that found in childhood, and it can be divided into complex partial seizures and also simple partial seizures. Complex partial seizures, which involve in temporal lobe, and an individual that have complex partial seizures may show automatic reactions like lips making, chewing, buttoning, and also unbuttoning of clothing. And it is a focal seizures. And complex partial seizures also similar to absent seizures, but they may confuse and disorganize, and also they may have sensory experiences, such as they can hearing sounds of various types. And the second types of partial seizures is simple partial seizures, which it's involved in motor cortex, and an individual with this type of seizures may have visual hallucinations, illusions, auditory hallucinations, olfactory sensations, and they also might have nighttime awakenings and also twitching of facial muscles. And then we go further into infantile spasms, or we can also call it as West syndrome. So, what is West syndrome? West syndrome is a sudden stiffening of muscles which a baby may show, like arms, legs, or head may bend forward, and it can occur about 1 to 2 seconds. So, these infantile spasms can begin at 6 months, and it disappear 24 months. The early treatment that can use is adrenocorticotropic hormone, and usually infantile spasms, or a baby or a child with infantile spasms, mostly they have intellectual impairments. To determine if a child or if an individual have a seizure, we must undergo evaluation, which is in the evaluation we undergo their family history, medical history, developmental history, and also electroencephalogram, or EEG. So when we undergo this evaluation, then we know what types of seizures or what kind of seizures that they have. The treatment for someone that or child that have a seizure mostly have two types of treatment, which the first one is anticonvulsive or anti-epileptic medications, and the second is surgical treatment. As for anticonvulsive or anti-epileptic medications, this is the most common or most used by an individual or a child that have seizures. So these medications it's changing the levels of chemical in brain. However, the anticonvulsive medications does not cure epilepsy, but it can stop seizures from happening. And it have side effects, which the most common side effects are weight gain, cataracts, drowsiness, and hair loss or gain. So for the second treatment, which surgical treatment, is used when someone cannot be treated or cannot be achieved through medication. So we undergo surgical treatment, which one of the surgical treatment is hemispherectomy, which the procedure is it is the removal of most of one side of the brain. And that's all from me. Thank you for listening. Thank you.